Your doctor has mentioned shoulder replacement. Here's what the surgery actually involves and what recovery really looks like. The shoulder is a ball and socket joint. The ball sits on the upper arm. The socket is on the shoulder blade. When cartilage wears away from arthritis or injury, bone rubs on bone. That causes pain, stiffness, and grinding. Surgeons typically consider replacement when severe pain disturbs sleep, limits daily tasks, and non-surgical treatments no longer help. In an anatomic replacement, both surfaces are replaced to mirror natural anatomy. This works best when the rotator cuff is healthy. In a reverse replacement, the ball and socket are switched. This lets the deltoid muscle power the arm when the cuff is damaged. Surgery usually takes 1.5 to 2.5 hours under general anesthesia, often combined with a nerve block. The damaged surfaces are removed, the bone is shaped, and the new implants are fitted and tested for stability. Most patients stay in hospital 1 to 3 days. The arm rests in a sling, with ice and medication controlling pain. Recovery is gradual. Gentle passive movement in the first weeks, active exercises by 6 weeks, strengthening through 3 to 6 months. Like any major surgery, risks include infection, nerve irritation, stiffness, dislocation, and over years, implant loosening. Most patients report major pain relief and better sleep. Long-term studies show many implants function well 10 to 15 years or more. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.